meeting. First order of business is to approve last week's committee meeting minutes. Motion made by Supervisor Taylor, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried. Okay, Pat, you are up.
Okay, good morning, everybody. First thing, we have an additional agenda item, and after the department head meeting where the administrator said we're not supposed to have additional agenda items, I apologize. But we needed to do it for now, because it's money. It's to amend our contract with Delta Health Technologies to include a specific product that will allow us to bill Medicare as a secondary payer. And in the past, we were able to bill Medicare the FISS, and Mr. Taylor, I put this specially for you because, so you'll know what the initials mean, which we can no longer do. And the cost is a one-time setup fee. You'll see $950 and $16 a month. And basically, we have to have this capacity with managed Medicare coming in. We're going to see more and more of it, so we have to be ready.
Okay. Can you get a motion to approve this, please? Made by Supervisor Frazier, seconded by Supervisor McDevitt. Any questions? All in favor?
Aye.
Opposed? Carried.
Okay, moving on to our regularly established agenda, we would like to request a resolution to appoint and reappoint the members of our professional advisory committee for the coming 2015 year, which we have to do every year annually by resolution. And if anybody wants to see who the people are, they're essentially the same as last year. And I have them, they'll be on file with the minutes.
Okay, motion made by Supervisor Taylor, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Okay, moving on, the same thing, we would like to request a resolution for appointing and reappointing our local early intervention coordinating council members for the coming year as well. Meetings are held semi-annually, more often if needed. Luckily, they've never been needed more often than that, but there is that provision. But we have to show that we appoint them by resolution.
Okay. Get a motion made by Supervisor Conover, seconded by Supervisor Taylor. All in favor?
Aye.
Opposed? Carried.
We would like to consider requesting committee approval to authorize Mary Lampkins, one of our supervising nurses, to attend the Home Care Association of New York State's educational program, Are You Ready for FIDA? Fully Integrated Dual Advantage, on December 5th in Albany. FIDA is a managed care expansion initiative for dually eligible Medicare and Medicaid patients, which again, more and more new ways of looking at how reimbursements are received and how the payers go. And we have to have this information to understand the system, and we do have funds available to cover this.
Okay. Motion made by Supervisor Conover, seconded by Supervisor Frazier. Any discussion? All in favor?
Aye.
Opposed? Carried.
Okay, we would also like to request committee approval to allow the WIC program to establish a Facebook page for their 2015 Performance Improvement Project. WIC helps you help your family, and in your packet you'll find exactly what that the page is going to look like, that it doesn't have any security problems or anything. With the new computer usage policy, we have to go through these motions to make sure everybody knows what's happening on Facebook. I talked to Mike Calvin, and he didn't think a resolution was necessary, only committee approval, and that it should be reflected in the minutes that we brought it to your attention. And I think it's a copy of Mr. Conover, if you're looking for it. It's at the end of the... It's an email. The project basically includes a media campaign and outreach it's designed to increase WIC participation.
Does anybody have a problem with this? Or? Pat, who will be in charge of administering the Facebook?
Oh, it would be basically, there'd only be Laura Safford, the person that is coordinating the special project, and the WIC program coordinator. That's not everybody. That would be the only people.
Okay. When it changes to Cornell, is it going to?
Well, that would go away.
This
is just the special project for this year. It would be time limited. They obviously wouldn't be able to get on our Facebook when they're at Cornell.
All right, that's fine. We don't need a resolution then, correct?
You do need an approval from this committee. It just doesn't go on to the full board.
Okay. Okay, motion made by Supervisor Frazier, seconded by Supervisor Conover. All in favor?
Paul, no resolution, it goes to the full board without a resolution, did you say?
No, it does not go to the full board, it's just this committee has to take a vote on it to approve it.
Okay. Okay, moving on to, resolutions for budget transfer and budget amendments. Ton, if you wanna, review what you have.
If you wanna do budget transfers, which is first at attachment number 6, and I have quite a few, seeing this is our last meeting for the year. I will say that from 2 to 11, most of those are all regarding moving some money to cover salaries and some fringe, not health or dental insurance related, but other fringes. And, I'm just moving some money there to go back and forth for that. Tammy's gonna explain though the first one, which is a resolution to move money for office equipment for, purchases of our laptops that need to be replaced.
We've had in March of last year, we presented a proposal for the replacement of our laptops. Currently, we had 79 laptops, and our proposal was to replace 60 over the course of 3 years. We took the first steps in that this year, and in discussing with Mike Colvin, we're, now the ones that are continuing to age, we're having, some efficiency issues. They're 6, 7 years old now. And in discussing with the IT director, our thought was, as we're looking at our budget to date, towards the end of the year, sometimes it makes more sense to, when you're looking at this in a global, means, if you had funds to purchase anything out of this year, versus waiting till next year, sometimes it makes fiscal sense to do that, and he concurred with that. In addition to that, these laptops were not part of the computer replacement plan that, has been presented as part of the IT department. That has changed, it now is going to be part, but covering the cost, the thought was to purchase 20 next year. So in working with conjunction with, Mike, he felt, as we did, that if we got 10 this year and 10 next year, that would make more sense. The other piece in that, too, is if we get our funding in January, everybody gets their funding in January, so purchasing the equipment then, we would be looking at a longer lead time before we would get the equipment in. So, it was very nice to have the IT director and be able to discuss the different options with them. So that's our plan going forward.
It took about 3 months last time.
Yeah,
to
it took
get
over
them,
3
so we're
months
not talking
from order to
overnight.
when we actually received the equipment.
Okay. Okay, motion made by Supervisor Conover, seconded by Supervisor McDevitt. Any discussion? All in favor?
Aye.
Opposed? Carried. Okay.
Also attachment number 5 and then attachment number 5A. The one that initially we did, attachment number 5, is no longer, that has request 1 and 2, void that, that's not what we're gonna be using today. I had to do it as 2 separate amendments. Attachment 5 is, asking to put in for the disease program, the $12,000 that we got from the state for Performance Incentive Initiative Award. And, that's gonna increase our revenue, increase our expenses, so we can utilize that money. But I'm asking for that now, so it can be put in and approved in the January 2015 budget, and, I guess budget amendments then, so that we can utilize it starting 2015. So that's attachment number 5, that's a budget amendment, and attachment number 5A is currently for our, a COLA with our children with special health care needs. They split it up between the grant, so this is only covering from October till March, but they want the voucher by the end of the year. So that's $739, and that's something that needs to be approved this year for 2014.
Okay, motion made by Supervisor Conover, seconded by Supervisor Frazier. Any discussion?
Mr. Chairman, so the committee is aware, because the amendment of the 2015 budget cannot occur until January by the board, that resolution would actually not come before you in December, but if this committee approves it, it'll come before you in January.
Okay,
The other one will be before you in December on the the 14 amendment.
Okay, let's find out. All in favor?
Aye.
Opposed? Carried. Okay.
Okay, moving on, we don't have any, pending items to be brought up this month. As far as information for discussion, you'll see our monthly report for emergency response and preparedness activities, attachment number 1. Status of referrals, attachment number 4. Sharon, if you wanna comment on the referrals?
Well, the referral status numbers I've given you are through October. The referral percentages from the physician's offices remain the same. Where our referral sources are decreasing somewhat is from, our local hospital. But when you look at the census of the hospital, they run about 160. And this is, we're used to dealing with an admission, their admission rate of around 300. So it fluctuates. Also, our physical therapy only referrals have decreased. And we're working on a plan. I wanna wait to see at the end of December so we can take a look across the board, from the area referral sources, different hospitals. But basically we were overall looking the last time in September of about a 10% decrease, which we had expected to occur with competition that we have. We're also moving towards one of our per diem status nurses that Pat and I will be meeting with to do some marketing strategies, which is very important for us to keep us visible in the community, but we're looking to reach out to Saratoga Hospital, Albany Medical Center, St. Peter's. Our referral sources from New York City hospitals still remain high, and we're individually tracking those now. We used to lump them from out of area, but now we're individually setting it up so I can get a better number on that. Also, as a whole for our certified home care agency, I have been very active in what is called the district plan, and I won't get into all of that at this point because it's quite complicated, but it has to do with your Medicaid reform and dealing with the Medicaid population, those patients and people that are costing the state and us a lot of money by using the emergency room as their primary care provider. There's different collaboratives that we can do and be a part of to help with disease, chronic management, and mental health issues. So I'm keeping our certified agency very active in that so that we can be major players. Down the road, this is a 5-year plan, projecting out of how many patients we can serve, and based on if we meet the percentage of within the area of the PPS, the Prospective Payment System Organization, we will be reimbursed a certain percentage of the money that's saved by Medicaid. So those are our plans for our CHOP as we sit here today.
I don't know if some of you read the article, it was in the paper over the weekend about Adirondack Health Institute and the monies that are coming to them. This is part of their collaborative, and we want to be sure we're on that team. And Sharon's done a nice job working with the other agencies. It's time consuming because the time frame is short for getting it in, but it'll be worth it in the long run because we'll be able to avail ourselves of some monies and some trainings that were we not at the table we wouldn't be able to do. So I appreciate Sharon's efforts in that respect. We'll keep you posted. Ton, expenditures and revenues?
Attachment number 2 is as of November 19th, our revenues and expenses currently year to date. Again, we're fairly consistent with last year at this time. Bringing attention again to our salaries. You can see that we're down in regular salaries by over $13,000 and overtime by over $25,000. And our part-time is up by 16, primarily because, as we've said before, we're using our per diem nurses, and we have a position or two available still in the regular salaries, so we're not utilizing because we're using part-time. I do want to just note that, just to give you an idea for year-to-date, on part-time salaries, while we're over 16,000 year-to-date, a little over 11,000 of that was just a cash out of a per diem or part-time person when they retired. So of that figure, we're really only over 5,000 compared to last year with all the per diems we've used. So it's actually a very year-to-date number that's really reflective of what we're doing. Attachment number 3 is the comparison, again, like I said, between last year and this year at the same time. And you'll see we're fairly consistent with everything. We're a little bit above in revenues, a little bit below in expenses right now. Between now and the time of closing, which happens in February, to close all the books for 2014, these numbers obviously will change quite a lot, and we'll see a lot more being booked. Primarily, a lot of it also is our preschool revenues, which for almost 9 months will be finally booked. They're not done until the state gets the report that we can work off of. But you'll see we're consistent, and again, it's been the same every year, every month, and the personal services overall, we're down $23,740 from last year at this time.
Any questions or comments? Supervisor Cano?
How, you survey to find out how, people, come to you, so that your advertising and your promotion,
We track referral sources.
track your referral sources, and you do that on a regular basis?
Well, we're looking at that, I don't know if Sharon had said, or Todd had said before, we're looking to drill down more, so that we'd want it to be more than hospital referral. We want it to be Saratoga Hospital or St. Peter's Hospital, which up until now, we've never had the need or the, the emphasis
the only
to even
town
do.
in town,
We
so-
were it, so now it's important for us to see where we need to beef up our advertising efforts.
But yeah, every referral that comes in, there's a section where you have to do on intake of where that came from. And we've expanded those areas. It's not just community, it's not just hospital, it's specific. I think I expanded it to 5 or 6. that
I think
have
we added
standing
6.
To expand on, so.
So we're thankful for our electronic medical record system and our whole thing that gives us the ability to do that, because if we didn't have that technology available to us, it would be much more problematic.
I know when I had, little hip surgery, I think you guys, were on their list, or that's who they recommended, okay? That's Albany Medical Center, and that's
Yes.
a big orthopedic practice.
Right, one of
so-
the biggest problems we've had is when they closed Washington County Public Health, HCR purchased, their certified agency. I'm not pointing fingers at any of our competitors, but HCR, which is true, is stating we're serving Warren and Washington counties. So there was rumor in Albany Med that Warren County also went out of business. So I contacted their case managing department and sent them our brochures and a letter and all that stuff to say, no, we're not out of business, blah, blah, blah. So that's another reason why we wanted to use this particular per diem nurse who was very knowledgeable of our agency. It would be an excellent representation for us to do that marketing, because marketing, it was never a part of our philosophy because we didn't need it, but we certainly need it today. And it's working. And there's relationships that we have with our competitors that we need to have, because not everybody fits in one little box. So we may be providing a service at some point, and then we see down the road that they need another program that's offered through a licensed agency or whatever, so. Matter of fact, I had the directors of, Home Care HCR and the director of, Fort Hudson in, my office 2 weeks ago, because we were working on this hospital-to-home collaboration plan. And our staff were very good about saying hello.
But there were no cars outside with their logos on it, so they really weren't
Right,
sure it
they
was
gave
them
me
until after they
personal
left.
Any other questions or comments for Supervisor Beatty?
Just a couple comments. I'd like to commend Pat and her team for a couple things. Number one is I like seeing actuals, exact numbers from last year on our 213 prior totals. I like that. I know sometimes different departments, we don't get actuals, we get just what they were budgeted for. So getting a truer picture and a clearer picture helps me, so thank you very much on that. And also, I noticed obviously that the salary to budget's down to 82.48%, which is a significant reduction. I understand you have an open position, but you're using the per diem, and that's helping control costs. So thank you very much for that too. It doesn't go unnoticed, so thank you.
Thank you. Anyone else? Okay, thank you, ladies. Hang tight, we have Westmount coming up.
Thank you. Happy Thanksgiving.
Thank you, and happy Thanksgiving.
You have the Westmont agenda or no? Do you have the, you don't have this? I don't.
chance to send out.
Like something came in.
Yeah, Joan sent it to us, he had questions. I think we're supposed to think.
These are the same things that.
Don't bother. Did I say that?
Yeah, these all came out in the email.
It was from Joan.
These came out in the email,
It's from Joan. Oh, okay, that was from Joan. He had sent it to Joan and asked her to get it out.
Right down, just to send it.
Down here somewhere?
Well, actually, Larry's up that end. Somebody should be up there. He's down by Larry.
In the back bench.
So he should be down by Larry, since he's already up
Warm
there.
up the bridge. Are you on the other side? Or this side?
Doesn't matter, as long as you're down at that end.
Right.
of the table.
Good. This is Michael's.
I don't get a chance.
Goodness, we got lots of paperwork today.
That's it? You kept it under 100.
Thank you.
Oh, my goodness. That makes so much fun though, doesn't it? I mean, I think the more 2 hours. Send them home with the parents.
The agenda? Yes.
Yeah, but I love chaos. It's organized chaos. I guess it's organized.
Sure it is, Ron.
If you wanted to.
Oh, yeah. Yep.
Did you get one?
Okay, while Betsy's handing out the material, we'll continue with Westmount. For those of you that were here last week, we did have a conceptual of the draft contract. We did answer some questions in executive. It was made public as of Friday afternoon. So if I don't know if any committee members or if any supervisors have any further questions, I would like to entertain those first, and then we can move to the public. Supervisor committee people? Okay, we'll open it up to the public.
We're discussing what?
The contract.
Oh, yeah.
Of course.
I put my comments in writing. I'll just say one thing, Mr. Chairman. I put my comments in writing.
Yes, it was emailed to everybody this morning. Joan had.
Opportunity to maybe get a response in writing, or I wasn't planning on coming up and going through this whole thing today. I submitted them in writing so that the committee would have an opportunity to review them and get back to me, and, but I wasn't going to go through the whole list.
Okay, well, I believe we.
What do you suggest?
Well, I personally just got it this morning.
Yeah, I just finished it about a half an hour ago.
Yeah, so I don't know if we all had a chance to review it, or, Mark, if we don't get, everything accomplished today, which we hope we can always have a meeting next week if need be,
Okay,
but, or we could send you, answers to those.
I would ask that you address it as you see fit.
Okay.
Okay, thank you.
Mr. Whitehead?
Thank you. Travis Whitey, Queensbury. Yeah, I got a copy of the contract late Friday and was reviewing it on Saturday and Sunday, and I still guess I have quite a few questions about it in my own mind. I'd like to, continue to look at it, but some of the things that struck me, and I made note of here, is that the whole issue of payments being guaranteed by the county, which was like a stumbling block beforehand. I could find no, the term guarantee never showed up in that contract that I could find. However, it seems to me that it's still clearly there, and I guess my question is, does council agree that it's still clearly there? I'm referring to the asset purchase agreement 3.8C. When you read that language, it seems to state that, we, the county, are responsible to make payments to the buyer, in the amount of the lease payments, due, less any Medicaid reimbursements. So, that would be the same as guaranteeing it. If there are no reimbursements from Medicaid, to the buyer, then obviously, that's gonna be a minus zero. So, it seems that, while we do, receive $729,000 on that portion of the sale, we are obligated to pay buyer, something on the order of $900,000, which I think is what's still outstanding, on that lease. Is that, do I understand that correctly?
I don't think you do.
Please, please.
If you look at, let me just go back to the basic concept, and then I'll hone in on your specific point. The basic concept here is that, the county has a lease with Siemens. The transaction is going to be that if Siemens consents to the assignment of the lease, then the transaction really then shifts to, the operator of the nursing home and Siemens. Payments will be made directly by the operator of the, I'll call them centers. Centers will make a payment directly to, Siemens. And part of the transaction in that situation is that there is an analysis of what those lease payments are that continue through July of 2017, and unrelated to the lease payments, but dollars coming in on Medicaid reimbursement will continue from the date of closing through December of 2021. So you have to look at the big picture of what the transaction is going to be from the day of closing through 2021. We have arrangements, as you know, if for some reason Siemens won't consent to the assignment, we have alternative provisions. But the concept would be is that the burden of making the payments on the Siemens lease shifts to centers. So once the closing occurs, there'll be no dollars from the day of closing through July of 17 coming from the county. It'll either be directly from centers to Siemens or pass through the county, but all the funds generate from centers. What you're referring to is the section of the contract that talks about the what happens if in fact there is insufficient Medicaid reimbursement to cover those payments. We have calculated based on an 80% Medicaid occupancy, even though the requirement is only 73%, we based the transaction on 80% to assure that there would be enough dollars on the Medicaid reimbursement to offset the amount of the lease payments. And if you do the math, you'll see that that will occur from the lease payments from closing through July of 17, and the Medicaid reimbursement is either 73% or 80% through December of 2021 will cover that. The question became that if you read through all of 3.8, the burden is all on centers. The only burden that the county retains is if the county acted or failed to act in any way that would affect the Medicaid reimbursement related to the cogen facility. That's if, and we would have that responsibility anyway. If we fail to act prior to the day of closing with regard to something the county was supposed to do with regard to Medicaid, that liability remains on the county. The other sole exception is if Medicaid determines that there is something unique to the cogen facility at Westmount that would preclude a Medicaid payment, and we cannot, we can't conclude that there is any such animal out there where there is something unique to the cogen facility at Westmount. That's the only other risk that the county retains. So when you talk about that section 3.8C, you only are alluding to the first part of the paragraph. If you go through the paragraph, you'll see that there are only two restrictions. One is acts or failure to act on behalf of the county prior to closing with regard to the cogen, and two, anything that's uniquely related to the cogen facility at Westmount. All other responsibility has been shifted to centers, for their, fulfillment. And there are all kinds of requirements that, centers has to do, including taking all administrative efforts, take all administrative remedies in order to try to, deal with the whole Medicaid issue, including commencing legal action if that's necessary in order to, obtain those Medicaid payments. So what this contract has done is taken the current full liability for the operation of the cogen at Westmount and shifted the vast bulk of that responsibility over to centers, and that, as I say, very limited responsibility left on Warren County. So hopefully that gives you a fuller explanation of just the fact that we're gonna take a look and see what the Medicaid payments are versus what the lease payments are, because that's not what the document purports to do.
Larry, I wanna just elaborate on that for a minute.
Sure.
Regarding your point about whether there's anything unique about the cogen facility at Westmount, OMIG, the Office of Medicaid Inspector General, has audited the Westmount's cost, right through 2008. Initially, when they did their audit, they were going to disallow the cogen cost. However, they put that on hold because Saratoga County had a similar situation and was fighting the state legally. Saratoga County won. OMIG relinquished or gave up on those disallowances and determined that these costs are 100% reimbursable. Just last week, I spoke with Cindy Trice at the Department of Health. She's responsible for setting the Medicaid rates, and she has assured me that the 2015 Medicaid rate for Westmount that will be published in January of 2015 includes 100% reimbursement for the interest expense on the lease as well as the depreciation. So we have done what we were supposed to do to make sure that these costs are reimbursable by Medicaid going forward before Centers takes it over.
I've also read that decision that came out about 2 years ago with Saratoga County, and it seems to rely quite a bit on the fact that while OMIG argued that the whole deal didn't make a whole lot of sense, the judge concluded that, well, the certificate of need, which was basically a contract between Saratoga County and the Department of Health, was in effect, and, you know, they should be following that contract. It seemed like that was the long and the short of the decision. Would you concur?
Yeah, that's basically it. The health department regulations clearly state that if you have an approved certificate of need, then the depreciation and interest are reimbursable costs. And that's why Saratoga County won.
And it's my understanding that Saratoga County actually has received these dollars. Is that
and Westmount has received dollars through 2008.
Correct. But after so that was all previous to the lawsuit. They've not received anything since the lawsuit was settled.
Who hasn't?
Westmount.
Westmount, where Westmount stands right now is their Medicaid rates are whole through 2008. They have rate appeals outstanding for those costs from 2009 forward. Those rate appeals are capital related. The health department owes them that money 100% because it's capital and because OMIG approved the costs. It's a question of timing when it's going to get paid. There is a related issue regarding what's called a universal settlement where the health department is trying to negotiate with the nursing home industry. This is a little bit of digression, but you need to understand it. There are rate appeals sitting down at the health department for nursing homes around New York State dating back to the 1990s. It's a huge amount of money that the state basically doesn't have to pay, even though they are obligated to pay it. So the health department is trying to negotiate with the nursing home industry to accept a settlement, a lump sum settlement on those rate appeals at so many cents on the dollar. That process is still well in negotiation. No one knows where it's going to shake out. There's a strong feeling in the nursing home industry that capital appeals should be excluded from that settlement because they are, again, covered by the health department's regulations regarding certificates of need. At this point, nobody knows what's going to happen to them. That's the only thing that could potentially jeopardize part of that money that's due to Westmount for 2009 through 2014. Like I said, 2015 going forward, it is now in the rates.
So, as I said, when the decision came down in January of 2013, subsequent to that, Saratoga did receive the payments. We received assurances from the Department of Health that there would be such, but they have not come. And when discussions were had with the Department of Health, they've indicated that OMIG continues to hold those up, but they don't really know why. At about the same time the decision came down, it was announced that Westmount was going up for sale. The RFP had been issued. And it would be my guess that OMIG might be looking at the fact that this certificate of need is going to be compromised if the sale goes through. Whether or not that is what they're thinking, I can't tell you. All I can tell you is that the money has not shown up.
No, that's not true. OMIG audited the rates through 2008. The initial audit was going to disallow the cost related to the facility.
And I'm talking about the monies between 2008 and today.
But this is important to understand.
Okay, go ahead.
OMIG did not disallow those costs in 2008 and the prior years. They've accepted that the project costs are reimbursable. It is not OMIG's responsibility to do anything with those rates after 2008 unless they audit those subsequent periods, which they will at some point. OMIG normally does about a 4 or 5 year block audit at one time because the statute of limitations for them to audit is a 6-year window. So they usually run it right till the end, and then they do 5 years at a time, which is what they did back here. So OMIG has already determined these costs are reimbursable. They can't now go back and say, oh, we've changed our mind. It's a done deal. They've made the decision. They are reimbursable costs. The only thing that hasn't happened actually is the health department regulations again say once an appeal has been approved or an OMIG audit has been completed, the health department rate setting people are supposed to roll those adjustments forward in the rates. The health department has not done that because of this universal settlement they're trying to achieve with the industry.
Thank you, but it's been my experience that done deals often get undone.
Oh, there's a thing
And that's
called
what
double
the courts
jeopardy.
are, yeah, I mean, it happens. Another point, another question is, Mr. Paltrowitz keeps on referring to centers, yet I don't see centers here in the document whatsoever. It seems to be Warren Operations Associates LLC or Warren Land Associates LLC, neither of which exist as a legal entity. Could you address that?
It was my understanding when the initial transaction was discussed and when actually I got involved in the transaction that it was always understood that there would be separate LLCs that were going to operate Westmount and own the real estate, which is consistent with the way that other nursing homes that have been sold and operated by centers are actually done. So that there was nothing unusual about the fact that in this transaction, there is a separate LLC to operate Westmount for centers, and there's a separate LLC to actually own the real estate for centers. And that's really what you're referring to, is reflecting in the LLCs that have now been created in order to operate those LLCs, or operate those.
I understand that. What I'm actually referring to is that the application to create that LLC was not filed until last week, and that I know I'm an LLC as well, so I know that it is not fully formed until publication occurs for a period of 6 weeks in the local paper. So I don't know how anyone could enter into a contract between the county and something that does not exist until such time as they do exist, which will probably be around the first of the year if they continue and put the ad in for the first time this week and do it subsequently for the next 6 weeks.
The LLC is created once it gets filed with the Department of State. There are requirements for publication. There are also requirements for future filings, none of which affect the efficacy of the LLC. So once the filing occurs, you don't have to wait for the publication to be completed or the filings with the Department of State following the publication in order for that LLC to be operable to function. So the fact that the process of doing those things to make the entity effective, doesn't mean that it doesn't have legal status the day that it was filed with the Department of State.
And if they file the first 3 weeks and stop filing for the next 3 weeks, you have nobody to go to. Because they wouldn't have they wouldn't have fulfilled the requirements and, they would not exist. Yeah, I think it's, I understand what you're saying, that, it seems like it's done all the time. But the other thing that I've been told repeatedly about the law is that it is a matter of, dotting your I's and crossing your T's. Or else you could end up in jeopardy. And I'm just suggesting that, here's another example where we're in jeopardy. But it's not the largest one, and I'll try to expedite my comments here, because I know we all have better things to do as well. But my largest concern with this contract has to do with a clause that's inserted in it in 1.9, optimizing operation of the cogeneration facility. And in particular, the statement that the seller shall terminate the performance assurance technical support agreement for the cogeneration facility to effectuate the termination of the performance assurance technical support fee. And I have a particular problem with this because this will be the third time that it shows up in official minutes here at the county. It'll be the third time that I enter this into the record. Article 4.8 from the Siemens Performance Assurance contract that we entered into in 2004, and that's the contract that has done all the damage here for all of these years. It's not the fact that you have a generator over there or don't have a generator over there. It's the fact that you have a lousy contract, and we're still suffering from that today. So it would behoove you to pay attention to what that contract says. And there's a self-destruct clause in there as far as Siemens is concerned to get them out of a lot of issues. Now, I know Mr. Paltrowitz has been engaged by the county to look into pursuing claims against Siemens. This very act that he does when he was also engaged in putting together this contract puts the county on a very thin standing when it comes to trying to effectuate claims. I'll read what the contract says. The performance guarantee is dependent upon and is subject to the express condition that the client enter into and maintain during the entire term of the performance guarantee period the performance assurance TSP. If the client fails to enter into, breaches, cancels, or otherwise causes the termination of the performance assurance TSP, this performance guarantee shall terminate immediately and be void of and no effect and no force for effect. Basically, if you don't continue this report, which we've been charged about $8,000 a year for, we've had the year 1 report, I've had issues about, year 8 and year 9 have not been discussed or nor voted on, and that's a concern to me. If you do away with that report, then you do away with your guarantee. So it's going to be difficult for you to pursue that if you drop this report. I question that. Excuse me. Sorry. So.
It's just, let me just respond to that if I can, just
Yeah, that'd be fine.
clarify that.
Thank you.
First I want to assure everyone that counsel for centers and the county are on the same page when it comes to the issue with Siemens. Neither want to take any action that would jeopardize any claims that the county has against Siemens up to the day of closing. It's both the interpretation, our interpretation and the interpretation from discussions with representatives of centers is that paragraph that you're referencing would only impact a prospective application and not a retroactive application. However, I can assure you and the supervisors that the county is not going to take any action, nor is centers, that would jeopardize any existing claims that the county has against Siemens. And if we need to have further discussion or to, supervisors had some question about that, or we had some further discussion with centers about clarifying that. What we're talking about is the, fee that's paid for a report generated by Siemens. And I wanna make sure everyone understands that's separate and distinct from the service agreement where the agreement with Siemens is that they perform work on the cogen facility for, repairs to the facility. This just has to do with that report. And again, our view is that that would be on a prospective basis, not on a retroactive basis. But again, I assured all the supervisors that whatever action the county takes would not jeopardize any claims that the county has against Siemens, up to the day of closing.
And yet Siemens continually disagrees with everything we have to say, saying that they're, contractually they've done everything correctly. They've responded to the ENERNOC report and other allegations saying, hey, read the contract, this is what it says. I just read you the contract. What it says, if you do away with that report at any point in time, you give up your right to that performance guarantee. And the $8,000 or so a year going forward, compared to the magnitude of the monies that we're talking about here, it seems to me a silly, silly thing to go ahead and worry about that kind of money and potentially jeopardizing this guarantee, which is clearly stated in the contract, clearly to me at least. I know, to lawyers they mean different things, but then again, I've just told you that this entity does not exist for 6 weeks, and yet he claims, well, it sort of does. So I mean, it does not exist until it completes its obligations to publish. But which brings me back to the Year 9 report, which we just got less than a month ago. Has a clause in here where Siemens is arguing against something ENERNOC had brought up. What they had brought up was the fact that in the contract it says neither client nor Siemens can change the parameters of certain parts of this agreement, the so-called stipulated guarantees, and yet they did. They claim that that was okay. They place the blame actually on all of you. This is what they say in the Year 9 report, which I obtained just about a month ago. The inclusion, let's see. Although ENERNOC disclaimed any intent to interpret the contract or opine on legal matters, it asserted that, as per contract, the avoided laundry costs should not be measured and adjusted by Siemens because of what I said. It says neither Siemens nor the client can touch this stuff. Based on this assertion, ENERNOC removes over $200,000 in additional laundry savings from its overall calculations. ENERNOC deducted these savings even though in other areas ENERNOC attempted to calculate actual savings without regard to provisions in the contract. The inclusion of the actual laundry savings is proper under the Performance Contracting Agreement. Articles 4.4 and 4.5 of the contract provide for Siemens to adjust the savings guarantee if the county changes its operations or business in such a way as to affect energy consumption as measured by the project baselines. But that's not in the stipulated portion of it. Siemens detailed the additional laundry savings in each performance assurance report going back to Year 1. This is the important piece. The County Board of Supervisors ratified this addition in its review of the Year 1 Performance Assurance Report and in each of the reports that have followed. So whether you know it or not, you guys somehow, according to Siemens, changed the agreement when the contract clearly says that neither the client nor, which is you, or Siemens can change this. But by accepting that performance report every year, that's exactly what you did. Now, accompanying this Year 9 report, which as I said we just got last month, was a letter addressed to Mr. Dusick, a cover letter. And in it, and on the back of it, it has a form that, has to be filled out and notarized saying that, the board went ahead and accepted this. Well, it also says that, and this is a letter dated July 31st of 2014, that if Siemens does not receive your response by September 15th of 2014, the reported energy savings will be deemed acceptable as presented. I mean, so you didn't even know about this, but you've already approved it. Because, you know, the date for September 15th long since passed before it was even disclosed that a year 9 report existed. So this is the kind of stuff, you know, that I've seen and railed against for the last year, and it continues. It goes on, it gets worse. There is a section in here that states where you acknowledge, I mean, I've bought and sold houses before. You always have to go ahead and say the roof, you know, I know the roof leaks or it's been taken care of or this or that. As part of that, there's a statement in here of no violations of law, licenses, permits, and registrations. And in here it says that seller's knowledge, there's no governmental authority except as disclosed in 2.3. No investigation, audit, or review by any governmental authority, including Medicare and Medicaid, is pending involving the facility, nor to the seller's knowledge has any government authority indicated an intention to conduct any such investigations, audits, or reviews, except as disclosed in Schedule 2.3. And Schedule 2.3 has a single word in there, none. So, you know, what I contend is just the very fact that you've hired as a second effort of Mr. Paltrowitz to go ahead and investigate, you know, the failings of the possible failings and the being able to pursue claims against Siemens and this cogen plant, you know, would indicate that, you know, there is something going on there, and to state otherwise would seem to be an issue. We also have heard that, you know, there are investigations going on at the county level, and they've been handed back and forth between the state and the you know, DA here and such. Right now I think it's with the AG. None of this is disclosed in Schedule 2.3. It simply says none. You know, there are a number of issues here, you know, that I question further. I don't think I've had adequate time to review this contract, but you know, I can probably find more. Would you like to address the fact that you know of no investigations?
Well, first of all, 2.3 is a provision that talks about investigations being conducted by governmental authorities, not internal investigations by Warren County, in terms of claims against Siemens. This has to do with the operation of the Westmount facility itself, not having to do with Siemens, not having to do with the cogeneration facility. It has to do with OMIG audits, Medicare audits, Department of Health audits, those types of things, and that's what is critical to the entity who's purchasing it. There's no question that Centers is aware of potential claims, because the contract does talk about potential claims that the county does have, and we reserve our rights with regard to any potential claims, including claims against Siemens. There's no question that Centers is aware that the county has such claims. This 2.3 is a representation with regard to if in fact there was an OMIG audit that was pending, or if there was a Department of Health audit that was pending. That's the type of thing that would get reported there.
I think there are OMIG audits pending, as far as my understanding, and I know that the sheriff has addressed you to say, actually, you know, yeah, there are things going on here, but he didn't think that the sale in itself would upset that. I think that's been publicly released. So, you know, the fact that Centers has an understanding of that, it would seem to be reasonable to me that, you know, such an understanding ought to be reflected in the document here, and so it can't be argued about, you know, down the road that you never told us about this. I mean, they understand it, put it in there. Well, why not? I think I'll end my comments there.
Okay, thank you, Mr.
Thank you.
Anyone else from the public? Supervisor McDevitt?
I just had a couple quick questions one for Larry, just as far as, we closed the transaction with Centers, some of the issues, that we have with Siemens as a county, the Attorney General still is investigating it. Do we give up anything in this transaction or any of our opportunity, to claim X, Y, and Z with, against Siemens?
We reserve those rights, we don't relinquish them.
Okay, and then I had a second question, Mike, you mentioned you had a telephone conversation with,
Cindy Trice.
a young lady.
Yes.
Would she put what she said in writing to you?
Yeah, I can call her and ask her to send me a,
Okay, good, thank you.
and actually, you'll see it in a couple of weeks, first week in January, the Medicaid rates will be out, and you will see that the costs are now 100% reimbursable.
Thank you.
Supervisor Conover?
Yeah, just, what would be, a reasonable expectation of, a schedule from here on in all the way to, closing and transfer of operations? Could you just, it doesn't be too precise, but you could give me some sense of.
Well, it's my understanding that the function of this committee is to make a recommendation to the full board with regard to, the approval of the contracts. And assuming that that takes place from the date that the county board of supervisors approves the contracts, the county then needs to also enact, a local law with regard to the transaction. And there's a time process for that. Simultaneously, while that's going on, a certificate of need and documentation from the buyer is submitted to the Department of Health. And it's really that time frame that's the unknown. In the past, that time frame has taken anywhere from 3 to 6 months to accomplish. So just to give you a rough idea, assuming that this committee recommends the transaction go forward and the board of supervisors adopts it, let's say at the December meeting, the time frame for getting this closed realistically would be a 6-month time frame, but that obviously can be extended based on what the Department of Health does. Other transactions have been delayed by the Department of Health, and others have not been delayed by the Department of Health. So hopefully that answers your question in terms of
Does that,
general time frame.
Mr. Chairman, a follow-on question? In the Department of Health, on the transfer of the operations to, any new owner, what are the things that the Department of Health, would concern itself with on that type of transfer?
Well, I think that basically what they're doing is they're taking a look to see the functionality of that entity and whether or not there's any reason why that entity would not be able to operate the facility in an appropriate manner. I don't know all the criteria that they use to evaluate that, but the whole purpose is to determine whether or not there's a need to have that facility operate, and will that facility be operated by someone who will comply with the requirements of state law and regulation.
Mr. Chairman, just to add to that, there was a question raised at the last committee meeting. I don't recall, it may have been Supervisor McDevitt, I don't want to put him on the spot, but I think there was a question asked about, how can we find out more about specialty care? How can we know that there's not some big issue out there? And so I discussed this with Lloyd, and I thought he had an excellent response, and it kind of ties in with what Larry just said. So Lloyd, perhaps you could just outline that to the committee since you have some familiarity with this.
I think, and Mike knows this also, they have to go before the State Hospital Review and Planning Council. I think they meet quarterly, as far as that goes. So if you get on their agenda, you're good. If you don't, you're gonna wait 3 more months. So that's how that plays. But they go through a character and competency evaluation. These gentlemen are in the business of running nursing homes, so I'm thinking whatever comes out will come out under that type of scrutiny with the health department. So I'd be fairly well assured they have a lot at stake here. And when they look back at this proposal, they're also looking at all their proposals, how their surveys are in all their units. So they're looking at them as a whole. So it's not just, a one-shot deal. So I would, it's a pretty extensive review.
Can I add one thing? They also do a financial feasibility review. They make sure that the numbers that Centers has presented in their certificate of need make sense and that they will indeed be able to operate the facility in a financially viable manner.
That's my point, Mr. Chairman, that I thought at least was, the case, that let's not forget that the state has licensed the facility and has to also authorize the transfer, if that's the correct term, of the license, and and that they're certainly gonna do their due diligence, as they do, elsewhere.
Martin?
Thanks, Mr. Chairman. I just wanted to expand very briefly on something that Larry had mentioned, and that once these contracts are approved, there's a couple of things that we can get right on. One is that local law. There's a County Law 215 process that we have to go through. It's what counties do. It's what Washington County did. We're gonna do the same thing. That is not a heavy lift. We can get that done in fairly short order. The other thing to do as well is to look at the subdivision aspect. Both the local law and the subdivision aspect are contingencies. We've got a surveyor who's working with us at this point, but those are things that we're gonna be working on, and already really have started working on for all practical purposes, that will happen during the winter months, while Centers is pursuing this certificate of need. We fully expect to get all those things done in fairly short order.
Supervisor, wait.
I just have a couple questions. First, as it relates to the terminology on page 15, when you're talking about the governmental authority and the, any pending investigation, audit, or review, I know you mentioned that for agencies such as Medicare and Medicaid, although it says including Medicare and Medicaid, when I look at the definition list, I don't see any type of a definition for government authority, excluding law enforcement or the state agent's office or whomever it might be. Is there a liability if we're not having it in this contract saying that we're aware of this ongoing investigation?
Well, two things. First of all, there is a definition for governmental authority, and it's licenses, permits, consents, approvals, or other authorizations required by law or held by a person for a particular purpose. So it's in the definitional section, and so it really deals with licensing, permitting, consenting, approval, and that authorization, so that's the definition of governmental authority.
I'm sorry, can you slow down just for one moment? Sure. Can you tell me where that is?
On page 3.
Okay. I see the board of supervisors meeting, but I see where it says what a buyer's agent might be, a board of supervisors might be, but where does it say what a government?
Okay, I'm looking at the asset purchase agreement. What we've been referring to is section 2.3 on page 15 of the asset purchase agreement.
Okay, great, thank you.
And that's what you were referencing, and 2.3 talks about governmental authority, and it's capitalized, there's a definition for that. And that definition goes back on page 3. There's a definition for governmental authority, and all I was doing was reading that definition to you. But but to answer your second part, I don't believe there is any exposure to Warren County with regard to any type of investigation that we're doing internally or that may be out there with regard to Siemens in particular, not with regard to the operation of the Westmount facility.
Okay, and then secondly, on page 23, when you talk about section C, what happens, and you can just put it in as plain English as possible for me. What happens, we know the Medicaid reimbursement is slow at best, right? So what happens if it doesn't come in? Are we on the total hook for that full amount to the seller, or to the buyer, excuse me?
First of all, we're talking about a process that's going to go through December of 2021.
Right.
So ultimately, the transaction continues, if it goes the way we believe it will go, is that there's no obligation on Warren County as the transaction continues, because the buyer is going to be making payments on the lease, assuming that those payments continue. What happens is then the county would only be liable if, in fact, the Medicaid payments don't come in because because of an act or failure to act on behalf of the county or something unique to the cogen facility at Westmount. So if, for example, those payments don't come in because of a delay with regard to the Department of Health operations, there's no exposure on the county. If in fact there is a global settlement with regard to Medicaid rates in general, I'm predicting what could happen in the future, there's no exposure to Warren County. We took specific attention to the fact that the whole Medicaid rate process is changing as we know it now. We don't know when it's going to be implemented, but there is a change in the whole Medicaid rate process. And if you read section 3.8, I know there's a lot of legalese in there, but what that does is that is confirming that whatever new rates get established for the operation, for Medicaid reimbursement, for the operation of Westmount, it's presumed that there is sufficient cost, capital cost, in those new rates to cover what we're accomplishing by having the Medicaid payments coming back to the buyer to cover the lease payments. So as the Medicaid reimbursement formulas change, the rates change, negotiation occurs, there is no exposure on the county that the buyer can come back and say, guess what, that we've got a rate that's lower than what we had anticipated. It doesn't include costs associated with the cogen facility. We've taken care of that in that we've limited the county's exposure as narrowly as we could to those two examples, or those two possibilities. And we think those are improbable, but they are possible.
Thank you. I clearly, I'm one of the few with these types of questions that I just want to understand it a little bit better. So what I'll probably do is just email you because it does bring up a couple other things and I don't want to take up everybody else's time.
Thank you. Go ahead.
I don't mind taking up a little bit of everyone's time, I'm sorry.
I just did read, page 3, governmental authority, and to me, the AG would be part of this. It says, means governmental authority means court, tribunal, arbiter, or any government or political subdivision thereof, whether federal, state, county, local, or foreign, or any agency, authority, official, or instrumentally of such government or political subdivision. To eliminate the AG's office from that would seem to be a stretch. And again, it goes back to if specialty care is aware of this, then why wouldn't you put it in there? Again, that, put it in there if it's understood, please. The other issue that I want to respond to that I just heard a couple minutes ago was the county attorney characterizing County Law 215 as not a heavy lift. County Law 215 will require you to certify that this facility is unnecessary for public use, and it will require a 2/3 majority vote of the Board of Supervisors. That's a much heavier lift than is typically applied at our meetings. Rarely do we see the requirement for a 2/3 majority. My concern is if this is treated as just merely another thing we need to get done and need to get done in a hurry, there might be the temptation to breeze through this. However, it doesn't seem like there's any reason why you couldn't have already done this already, involved the public. I mean, actually, when this was built in the 1980s, I'm sure the public was involved, and I'm sure the supervisors were saying there was a need to build this. What has changed since the 1980s, and shouldn't the public that was, in on that decision be in on this decision now to go ahead and say that it's unnecessary for public use? To me, it's not just a technicality. It's not it's not that it's not a heavy lift. I think it's something that needs to be addressed. You've got the time to do it. Do it. The longer you postpone this, the more excuse you're going to have to shut the public out. And that upsets me. Thank you.
Supervisor Conover?
Just refresh my memory, we went out on the street with the RFP approximately when?
Almost 2 years ago, I think,
October 2012. Thank
Supervisor Westcott.
I'll keep my comments brief. I just had a couple points after listening to everybody. I'm gonna thank you for all your work on this. My main intent is just trying to understand the agreement. I appreciate those documents getting to us on Friday so we could spend the weekend looking at them. I apologize that my comments weren't available until this morning. I got up at 5 and spent 4 hours on it. And so I apologize also for the typos in it. I'd like to get together, if I may. I sent an email last Thursday. My main concern, I guess it's not a concern so much as my main lack of understanding is on these Medicaid payments. There is a lot of legalese, Larry, and I'm not a lawyer. I get confused by it. I just want to see it broken out in layman's terms so I understand. So I'd appreciate an opportunity to get together with you and Martin. I sent you an email to...
I know we responded, we said that we were available all day on Friday, and we didn't get a response, so, we did respond to your request.
Oh, you did? I looked for it, I didn't see it. Can we get together early next week?
Mark, I left you 2 voicemails.
Huh, they're not on my phone. All right, well,
But the answer
listen,
is yes.
my technology is, you know, my skills with technology are limited. So can we get together early next week? And I'd just like to sit down and I'm not trying to cause an issue, I'm just trying to get a meeting to sit down and go over the Medicaid payments. So, what I'd like to do is have it simplified, take the legalese out of it. My questions are in my document, they're very specific. They're simple questions like how much Medicaid was part of the original deal and how much has been paid year to date. And, you know, if by the time the contract's signed, we don't get, how much more are we owed by the time the contract is signed? And if we don't get that in at that point, how is that handled? They're just kind of more layman type questions like that. They're all outlined there, so, you know, if we could go over those. Because the 3.A section I found very confusing, and it kind of gets to where Rachel was going with it. I just want to make sure that all the supervisors clearly understand what the liability is, okay? I've heard your answers a number of times, and I still can't quite get the numbers to add up. I just don't understand it. Maybe I'm just thick-headed. Wanted to address a couple things that Travis talked about that were responded to. And Mike, I appreciate your comments, but, you know, we just got paid IGT money this year, correct?
Right.
But we're anticipating we're not gonna get it in the future.
That's not necessarily true.
It's not necessarily true, but it's been forecasted in our multi-year plan that, you know,
That's not correct.
we can't count on it, right?
It's not correct.
It's not?
No, it isn't.
What are those deficits a result of?
Those are deficits as a result of operating the facility, even assuming the IGT funds.
Even assuming the IGT funds? Okay, so we're anticipating we're gonna get IGT in the future, is that correct?
That's correct.
Okay, all right, good. Well, we haven't received 7 years of the Medicaid payments. It's 7 years, is that correct?
That's correct.
Okay. And I just, that's disconcerting to me personally. It's not like we just got paid last year for 2 years ago. We are still owed 7 years of payments. So that's really where I want to really understand, so we understand what the liability is, because the way I read the contract this weekend was we were still, in essence, guaranteeing those payments going down the road. So I just want to understand that. On the setting up of these LLCs, you're right, this is how they have set this up, and we've known that for a long time. But one of the things that I want to remind people of is that we did receive a proposal from another LLC, and we had certain concerns over that proposal. And that was actually the high bid with Midwest LLC. And it wasn't that long ago that we talked about these concerns, so I just want to make sure that we are comfortable with these LLCs being set up, because in essence, we're buying into specialty care, but I don't see where there's any direct link with these LLCs and specialty care. So maybe maybe you can point that out to me, where the linkage is. Because we're really buying into specialty care. And yes, they set up these LLCs. I'm not worried about that as much as I just wanna make sure that specialty care is behind us. So I think that's the point there. The upcoming meetings that are gonna take place, I think there needs to be the meeting, the 215, and then there needs to be a resolution passed that determines, that the facility is unnecessary for public use. Do we have any sense of timing for that?
As I indicated, and I think Mr. Whitehead kind of mischaracterized or misunderstood my comments, the heavy lift is for me. It's not a heavy lift for me to put these documents together, for the 215. It seems to me that the, enunciation, if you will, of the public use, no longer needed for public use, can happen at one of two instances. It could happen when the board takes a vote on the contract, which, could be as early as December 17, or sooner perhaps, or at the time that the board acts on the County 215 local law at that time as well. I think, I have to go back and check, Mark, but I think that may have been when Washington County did theirs, but I'd have to go back and check and confirm.
Okay.
But I think there's my point is I think there's multiple opportunities to do that as we go along. As far as the time frame that can happen, I don't expect the local law to be acted upon in December, but the local law could certainly be drafted and acted upon as early as January, February of 2015.
Great, thank you very much for clarifying, Martin. The whole notion of this termination of the Siemens Performance Assurance TSP that Travis raised, I just wanted to get another opinion on this and took it to my own attorney. And like most things in law, they can be interpreted differently. So the interpretation that my attorney gave me was that there really is something to that. So, Larry, you had mentioned that it's up to the day of closing. You would use the words that the retroactive claim is good up to the day of closing. Did I hear that right?
What I was saying was that be sure that whatever actions that we take with specialty care with regard to this transaction, that any claims that the county has up to the, when I say up to the day of closing, is once the closing occurs, assuming that there's an assignment of the lease, then it's a matter of specialty care and Siemens. So any claims that we have up to that point in time, we would be able to assert, and certainly we've got provisions that say that we reserve those rights.
Okay, so we can reserve the rights even if the actual act of taking action took place after the closing?
We can commence a lawsuit after the closing, but it would obviously have to relate to transactions that occurred prior to closing, because we no longer
Gotcha.
would own or be operating the
Gotcha. I just wanted to make sure I understood that correctly. Thank you. My final comment is just on the idea of spending $20,000 for the optimization of the operation of the cogen. There are two provisions in the contract that says that the buyer will take it as is, and yet we're offering to throw another $10,000 in there to optimize the operation of the cogen.
I actually think that's the other way around. I think these are expenses that the county needs to incur presently, and if the county would have to spend upwards of $20,000 to do the repairs that are necessary in order to operate from the next X number of months until the closing. And this was, again, negotiated prior to my involvement, but it was basically, the buyer was willing to put up $10,000 of that 20 that the county was gonna spend in any event, to make those repairs. So from the county's perspective, it was a way to share a cost that is gonna help the county short term, but obviously will have an impact long term on the facility as well.
Can you?
I understand it, but
Is that right, Paul?
Yes, that
yeah.
is the correct understanding, and keep in mind, at the time we negotiated this, we were back quite a while, so we thought that at that time, before this had gone on as long as it has, that, those enhancements would have been made a while ago, and then during the course of all the other things that had to go on, that both parties, we would enjoy the benefit of them, and then they would enjoy the benefit. That's still true, but obviously we're looking to move this as fast as we can forward so that we can avoid the deficits that we will incur running the facility. So we may not enjoy as much of a benefit as we would have at one point.
My final comment is on 2.3. I too agree that we should be making mention of the investigation. Westmount is powered by the cogen. The cogen is part of this deal. It involves Medicaid payments, and there's an investigation going on. I just think it should be in the contract as noted in that provision 2.3. Thank you. Appreciate your time.
Okay, anyone else? Supervisor Brock?
I'm not sure how to ask this question, but what if, centers or specialties a year or two from now isn't doing what it needs to do with the cogen, is not fulfilling its need? What kind of bind does that put us in?
I'm not sure specifically what you mean, in terms of what? In terms of
Maintenance or whatever they have, I don't know what, that's why I'm saying I have a hard time with the question, because I don't know. But they're not, I mean, we're sort of throwing the responsibility on them to do what we would be doing. What if they don't do it for whatever reason? I'm assuming they will, but.
Right. So we have a claim against them if they didn't fulfill any obligation that they said they were going to fulfill, whether it be that aspect of it or any other aspect of it. We've got, they've got an obligation, for example, to operate the facility for at least 5 years. If they fail to do that, we would have a claim against them for that.
But then would that put us in a situation where we're confronting centers and Siemens, or how is that?
Possible.
So it could really blow up in our face if center doesn't do what they're supposed to.
Well, if anything else, if they stop operating the facility, obviously that's an issue. They're contractually committed to do that. They're actually committed to operate the cogen facility through December of 2021. And if those are major things, if they don't do that, then there would be claims that the county would have against,
Well, what I'm thinking is, instead of going down that route of a lawsuit, could we be notified that there's something going on, so that maybe we could take action to do the thing? I mean, it might be cheaper to do the maintenance than it is to go through a major finger pointing and all that.
well, there are notice provisions in, I don't know about, in particular about the operation of the facility, but there are notice provisions, for example, if there is, audits, if there are certain, things that are occurring with regard to the operation of the facility, there's a notice requirement that the county, knows if it has anything to do with the, components that would affect the county. I mean, that helps you, in understanding, I mean, it's hard, without knowing specifically what it is that you're contemplating, it's hard to give you the answer.
That's my problem too. All I'm trying to do is avoid a problem. I don't particularly, so if we have feedback of some kind, then perhaps we can make proactive decisions.
Okay, I'd like to thank everyone for their comments.
That 53 pickup truck that we're selling to them, or how come we're not holding on to that 53?
You want it, Pete?
That's okay. No, just somewhere along the line, I saw that there, and I think we needed that.
Yeah.
Mr. Whitehead, really quick, because we still have a standing agenda to go through.
Mr. Dusick just indicated that we are contractually obligated, we've asked Siemens to go ahead and give us this $20,000 improvement. I'd like him to produce a purchase order showing that. I've never heard anything about it. I do know...
I did not say we have asked them to do it. I said that was an enhancement that both parties agreed would be beneficial to the facility. There has been no agreement with Siemens to provide that service as of this time.
So I guess, then why are we, we're getting no benefit of it. now, we're selling it, why would we do it? The other thing is, you know, would you believe Siemens, telling you that, yeah, pay me another $20,000 and I'll make this better? I mean, after everything that you've seen, you know, why would you not look into that a little bit more closely? From what little I saw about that proposal, for $20,000, is it said that, it enhances the, summer operating, capabilities by going down to a single, generator on at a time or something like that. At any rate, it's not summer, and this is gonna be over, you know, supposedly before summer, so, you know, I would question that.
But here again, that's why I mentioned the fact that when it was developed and when that was negotiated, it was a benefit to the county. Things have changed now, because it has been so long. Whether or not, but it was all part of the deal and part of the transaction that was negotiated at the time. So it seems to me that, that is still a benefit to the county if this deal goes through because of it.
All right, thank you.
Okay, again, thank you everyone for your comments. This is an action item. I don't know how the committee feels. I would personally like to move this forward to the full board, on the 17th, correct?
Correct.
19th?
19th of December, 19th? Thank you, Joe.
What is the committee's pleasure?
I'd resolve and move it forward.
Okay, motion made by Supervisor Taylor, seconded by Supervisor Conover. All in favor?
Aye.
Opposed? Carried. Okay. Lloyd, we do have an action agenda. Do we need Mr. McCarthy, though, for number 5?
That was, he's welcome to stay. That's, you'll see that that's actually my recommendation.
Okay.
I think I can handle that.
Okay. Thank you for your time.
Thanks.
And do we need Larry?
I think we're all set.
Thank you, Larry. Appreciate it. Okay, Lloyd, please take over.
Okay. We've got several, items today. We'll be brief. Betsy will start out with, the first few.
First item on the agenda, miscellaneous resolution request authorizing the adoption of electronic certification of the corporate compliance program for West Nile Health Facility. It consists of a compliance manual, the compliance protocols, appropriate written policies and procedures affecting any risk areas in this facility's operations. I have 3 pages after that. It's an outline of what the corporate compliance entails. There are a description of the function of the corporate compliance, our members of the committee, 10 standards of conduct, and also I just wanted people to be aware that our website holds a copy of the corporate compliance manual. In summary, corporate compliance is about complying with regulatory mandates. The ultimate goal of the corporate compliance program is to improve the quality of care provided to residents. So I can go further if anyone is interested in issues and don'ts, what to do.
Is the committee okay with this without researching it more? Okay. Motion made by Supervisor McDevitt, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried. Okay.
Resolution request number 2, new contract for Mahoney Notifier Plus, page 2. This provides semi-annual test and inspections of fire alarms, sprinkler alarms, security alarm for West Nile Health Facility. They haven't raised their cost in about 3 years. It's $1,500. I'd like to include an additional $1,000 for emergency repair. They come twice a year, and they bill us half the cost each time they come.
Motion made by Supervisor Taylor, seconded by Supervisor McDevitt. Any discussion?
What emergency repair? Do you have an idea of what that is? Emergency repair, you said emergency repair.
Right, but sometimes we need some sort of alarm, additional alarm repair.
Smoke detectors, heat detectors that go bad from them.
Okay. Okay, all in favor?
Aye.
Opposed? Carried.
Resolution request number 3, amend county budget to reflect insurance recovery. We had a loss of dentures for a current resident. The day of loss is April 17th.
for $1,200, and we submitted it to our insurance. Our insurance has paid us, so now we would like to, amend, the appropriate, expense and revenue account so that we are able to spend the money.
Okay, motion made by Supervisor Conover, second by Supervisor Frazier, all in favor?
Aye.
Opposed, carried.
Number 4, miscellaneous request, authorizing payment to McCarthy and Collin LLP. The amount of the payment is $765. This is for 4.5 hours at a rate of $170 an hour that we asked Mike to do for us.
Yeah.
Do you wanna elaborate a little bit?
I can. Thank, Mr. Chairman, thanks, Betsy. I think as we go along here, we're gonna continue, to need Mike's services to some extent. And I just wanna make sure that there's a mechanism, where we can call him, we can ask him to come to meetings, and right now there isn't. So I thought it was a very good idea as we go forward here, especially with some of the things that are upcoming. In my view, Mike has been invaluable. He's always available, always answers our questions and gives us good suggestions. And I just think we'd be well advised to have this done so that we have him on board.
Okay. Motion made by Supervisor McDevitt, second by Supervisor Conover. Any issues with this? Okay, all in favor?
Aye.
Opposed? Carried.
Item number 5, this corresponds with item number 4, resolution request a new contract with McCarthy and Collin. In case, we have future needs with him, we estimated about 20 hours of $170 an hour, not to exceed $3,400.
That's in the budget? Motion made by Supervisor Frazier, seconded by Supervisor Taylor. All in favor?
Aye.
Opposed? Carried.
Item number 6, resolution request transfer funds. This is, my year-end salary cleanup, moving money around. There's also the first, transfer, is to help pay for interest of loan repayment to the county. And, the rest are just salary movement that we have budgeted already, just need to move it around.
Okay, motion made by Supervisor Conover, seconded by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried.
Next item will be, requesting a room rate increase for a private charge. This year we did a increase, February 1st. Our rate is basically the lowest one in the area. And historically, most nursing homes have a rate increase annually. This would be about a 3% increase. $10 a day would be giving us a rate of $325, including, the New York State assessment. With the pending sale and everything, you know, things will change when the new owner takes over. So I think at this point, this will get us up to comparable to other homes we called around the area, see what they're charging. We have one rate at Westmount, private or semi is one rate. It's historically been that, and I'm not interested in changing that now. So my request is for the resolution for a $10 increase up to $325 a day, effective February 1st, 15.
Okay. Motion made by Supervisor Frazier, seconded by Supervisor Taylor. Any comments or discussion on this, Supervisor Conover?
How many beds would fall under this category?
Well, this would be our schedule of charges, so it basically would only impact on the private pay
Right.
population.
Or approximately?
And how many today? 12 today, maybe? People in the building, has no effect on your Medicare or Medicaid rates, as far as that goes. So the people actually paying this rate are the private pay people.
So assuming you had kept that percentage and you had them occupied over the course of a year, this would be approximately $30,000 to $40,000, something like that.
It could be 100, 120 a day, but, you know, it goes up and down.
Right.
Moving target.
Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Carried.
Okay, staffing report, we do have some vacancies still in our nursing department, but we are always hiring and always, doing the best we can over there. We currently still have 5 people out on disability, due to various medical issues, pregnancy, whatever. We do expect them back, probably before the end of the year, most of them. So that will help us out a little bit on, some of our staffing. Betsy will do that overtime report now.
The page 9, the last page that you have in your packet. We're right on schedule for what we've budgeted. It just looks a little funny, our regular and our part-time costs increased just because of the new positions we've created and we're funding them through the full-time, the regular. So this is why there's such a large decrease, a large increase in this year. But overall, what you wanna look at are your totals at the bottom, and, we will be within our amended budget for 2014.
Nice job.
Yeah, and the other thing, the last thing I just wanna bring to your attention, I was saying for a few meetings, we were in the survey window, so we had our survey, and, they exited on the 10th of November. The staff did an excellent job. We have a few building features, which have been there for 30 years that they picked up on, so minor items. We have to add a couple sprinklers out on the overhang in the front of the building, because they'll go up to 4 feet, but it's 51¼ inches out there, so they want that sprinklered. And, we smiled and said, okay. The awning that's hooked to the building, the long green awning, they wanted that sprinklered, but they said if you don't have it hooked to the building, you don't have to. So we took the 4 lag bolts out of the overhang, and it's now freestanding and doing quite nicely out there. So, we have 1 care issue item, it was regarding some resident waits. I'm working on the plan of correction as we speak, but the staff did an excellent job. They were there 4 full days, 5 people, and as you know, they go through everything. So, very proud of the staff over there, and, we came through, I guess you would say, with flying colors, so.
Thanks.
Now we have 1 request for a very quick executive session.
Before you go into that, I'd just like to comment. I was at Westmount for a considerable period of time in the last month, and I just wanted to say that my experiences there were extremely positive. The staff was amazingly good. Unfortunately, I have a previous experience in the area which was not as positive with my mother. But the point I wanted to make was that while I don't think it's been posted on the Medicaid site, when I went ahead and dealt in both cases in trying to find a place for my mother to go, you go to the Medicaid site, you see how many stars they're rated, all these different facilities here. And, historically, Westmount has been 2 stars out of 5, reasonably low in the area. The Pines had been 3, they're down to 2. The Stanton's still up at 3. Fort Hudson is up at 4 or 5 stars out of 5, consistently. I just like to say that from what I've seen in the past year, the changes there that Mr. Cody's put through will probably end up getting you, or getting, the future buyer up. And it's positive for everybody. It's positive for the community. It's positive, it's a feather in the cap for the job that Mr. Cody's done. And it'll be a benefit for the buyer. And I wish, and I think it's just good for the community. It's a good place. That's all I wanted to say. Thank you.
Appreciate those comments, and I still think he gets paid too much, but that's beside the Martin, can you head us into executive, please?
Yeah, Mr. Chairman, we need a very brief executive session for the purpose of discussing a pending matter with the Department of Health, an enforcement matter with the Department of Health from 2011. Again, I expect the discussion to be very brief, and I expect action to be taken following the executive session.
Okay, motion to go in executive, made by Supervisor Frazier, seconded by Supervisor Taylor. All in favor? Aye. Opposed? Carried. Thank you.
We need a break anyway.
Find something else.
Plus, we want to be on TV. in executive, we did discuss a matter. We are going to need to take action on this. Martin, can you give us the explanation, please?
Mr. Chairman, it's my understanding that the committee would like to entertain a motion to authorize the chairman of the Board of Supervisors to execute a stipulation and order in a pending Department of Health matter regarding the Westmount Health Facility, regarding a matter from December of 2011, to be more specific, and authorize payment of a civil penalty in the amount of $2,000 with a funding source for that. Betsy, if you could recite.
It is, EF 83110-8303-469 is out of the regular general
Okay.
health.
Thank you.
Okay. Motion made by Supervisor Conover, second by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried.
Thank you.
Okay, thank you very much. We need a motion to adjourn, made by Supervisor Conover, second by Supervisor Frazier. All in favor?
Aye.
Carried. Do you need any of this stuff, Joe?
We're on to the board meeting.
How are things, Ed?